Hi, I'm Shantalia Shova,
I'm Shirley Yashova.
and we're presenting today on the cross-reactive neutralizing antibody responses elicited by SARS-CoV-2 501YV2. The severe acute respiratory syndrome coronavirus 2 501YV2 lineage, first identified in South Africa in October 2020, has mutations that confer increased resistance to plasma from convalescent patients and vaccine recipients, as well as to some monoclonal antibodies. However, the immune response to 501YV2 is unknown.
Similarly, the ability of antibodies elicited by 501YV2 infection to cross-react with other variants is unknown, but such cross-reactivity would have implications for the ability of second-generation vaccines based on the 501YV2 spike protein to protect against infection with the original and emerging SARS-CoV-2 lineages.
The authors characterized the SARS-CoV-2 infections in a cohort of patients with coronavirus disease 2019 who were hospitalized in the Groote Schuur Hospital in Cape Town after the emergence and dominance of 501YV2 in South Africa.
Blood samples were obtained from 89 patients between December 31st of 2020 and January 15th of 2021.
Of these patients, 28 were randomly selected for SARS-CoV-2 sequencing, all of whom were shown by phylogenetic analysis to be infected with 501YV2.
Furthermore, at this time, the epidemic in Cape Town and in South Africa as a whole was dominated by 501YV2, which accounted for more than 90% of infections.
No patient in our study reported previous SARS-CoV-2 infection. They first assessed the binding and neutralizing antibody responses of these patients to the 501YV2 spike protein. As with the original variant of D614G, 501YV2 elicited high titer binding and neutralizing antibody responses.
Furthermore, titers of binding antibodies to the receptor binding domain, including all of subdomain 1, and the full spike protein of the original variant were highly correlated with titers of binding antibodies to the corresponding proteins of the 501YV2 variant.
Titration of a subset of 46 samples revealed that plasma samples had higher titers to the spike protein of 501YV2 than to the spike protein of the original variant by about 1.7 times, but high-level binding to the original variant still remained.
The authors previously reported that plasma from persons infected with the original variant showed substantially lower neutralization of the 501YV2 variant than of the original variant. In the current study, they performed the reverse experiment by assessing the cross-reactivity of the plasma neutralizing responses in the Groote Schuur Hospital cohort of patients with 501YV2 infection against the original variant and against 501YV3, the variant first described in Brazil.
They first tested 57 plasma samples from patients at Groote Schuur Hospital against both 501YV2 and the original variant, and found that 53 of 57 samples maintained neutralization activity against the original variant with a geometric mean titer of 203, which is approximately one-third of the titer against the 501YV2 variant. Finally, they tested a subset of 10 plasma samples against the 501YV3 variant and found high levels of neutralization of this variant, with some samples showing higher potency against 501YV3 than against 501YV2, a finding that may be due to the very different N-terminal domains of these variants.
Overall, they found that 501YV2 elicits robust neutralizing antibody responses against both the original variant and 501YV3, which indicates high levels of cross-reactivity.
The data indicate that vaccines built on the spike protein of 501YV2 may be promising candidates for the elicitation of cross-reactive neutralizing antibody responses to SARS-CoV-2. And that's all for our presentation today. Thank you so much for your attention, and we hope to see you next time.
Thank you.